Reading through the articles, I found the shifts and workloads that residents have to work rather concerning because the increased possibility of error while they're sleep deprived. Um, of course, not all people are affected by loss of sleep the same way. I think of Dr. Ben Carson's 22-hour operation, which I believe was the first operation that uh, separated conjoined twins, and it's unbelievable and unbelievable display of drive and determination that physicians have, but not everyone can handle something like that. And when I worked at a paper mill during my summers in college, there were several times that I had to work 16-hour shifts, and around hour 13 or 14, you start to notice making mistakes that easily avoidable, and your brain just kind of slowly shuts down, and your alertness would start to slip. And that's something it was a simple scale of working at a paper mill, and it wasn't really the dire consequences of working at a hospital or coming up with a treatment plan or what medications to give a patient or performing an operation, which has much worse consequences for a mistake. And I think we have to have a patient-centered atmosphere, and to achieve that, I think well-rested physicians is definitely a priority. And I tend to agree with the IOM report, and it suggests that, and its suggestions, but I feel that to implement many of these suggestions would increase the cost of healthcare, such as providing transportation for doctors commuting from home after long shifts or when they have lack of sleep, and also maybe providing them somewhere to stay um, at the hospital, catch up on sleep or nap. I think that's a very good idea, but it could also be expensive to make those accommodations. But there definitely has to be better standards that set more time aside for residents to get more sleep. And I know med students probably won't like to hear this, but maybe residency should be longer, so there isn't a time constraint on trying to learn everything, be exposed to everything. So if you stretch that out longer, and also maybe that would also create more people in the residency pool, and they'd be able to pick up more shifts by having more residents in the circulation. Uh, and also, the bottom line is patients shouldn't be exposed to possible harm because of sleep deprived doctors, and the safety of the doctors is put at risk also. The articles mention things such as needle sticking, poking themselves, being exposed to bloodborne pathogens, and also the risk of driving home after these long shifts. Uh, I think each educational hospital should come up with its own schedule for residency, based on the resources they have, how many people in residency they have, um, if they have any special treatment uh, opportunities. And then that should be reviewed by some sort of panel just to ensure that patients are being exposed to potential mistakes by sleep deprived doctors. Thank you, everyone.